If you've got a complex back pain patient, very often it's good just to step back and see how the patient goes to touch their toes, because there's quite a few combinations that we see which can give you clues where to go next in your objective assessment. So for example, if we just look at a normal toe touch for Becky and her normal strategy, we see it's quite nice. She gets a good ribcage depression, her hips travel back at a similar speed as her ribcage depresses. She's got that good hip and ribcage rhythm. Now very often what we can see with some back pain patients is we see excessive hip flexion. So if you just do that again, Becky, but push your hips right back, pause there for me, Becky, we'll see at this point that the back hasn't actually relaxed, and then you get this kind of extensor loading tolerance as they come down. Then we might see the other situation where the hips don't travel back at all, and then she excessively lengthens through the hamstring. So if you keep your hips forward, Becky, and you reach forward, now that's quite a hard one for Becky to do, but a lot of back pain patients, we may see that also. How the patient's moving at the moment and the strategies that they're using is very useful then to take into your next phase of your objective assessment. So if Becky is using an excessive hip flexion strategy, then the next question in our clinical reasoning process is why. What's not doing its job that's causing her nervous system to utilize this strategy to get her from point A to point B? And the answer to that usually lies in the patient's story.